There are people who believe that their religion prohibits them from being donors. The most obvious examples are Muslims and Jews, because in both groups there is a preference for burying the body quickly and for burying the body whole. But the brochures that I was talking to you about a moment ago, the religious leaders make clear that those preferences come second to the responsibility to help someone else if you can without risking your own life. So there are religious misconceptions, even Catholics. I've been talking to you about the work we've done with the Catholic Church. We sometimes encounter members of the Catholic faith who mistakenly think that their church doesn't support donation. So there are religious misconceptions. I think the other large misconception is the idea that somehow if the doctors who are looking after you when you become ill know that you're prepared to be a donor, they won't try hard to save your life. And we try very hard to explain to the public that that just isn't true. I mean, first of all, we are bound ethically to be sure that the doctors who are responsible for someone who needs a transplant, a recipient, are never the doctors who look after someone who could die and be a donor. We maintain a clear separation in terms of the medical teams and the nursing teams who look after those people. So if you're in an accident and you come to the emergency department, the physician who's attending you is not a physician who's involved in transplant. And the physician's clear responsibility is to do everything they can to save your life. So that's very important. We also abide by what is known in the field of ethics as the dead donor rule, and we're scrupulous about this. We require 2 physicians independently to proclaim a person dead before we would proceed to recover organs. So that's a second misconception. And I can tell you, my own staff, the physicians who are the most supportive of donation, this very clearly comes after their efforts to save people's lives. If I could take your viewers into our call center and I could show them the grief our staff feel when someone dies, it's very clear if you work in this field that you know that the donation comes after considering the importance of saving someone's life or the respect for someone who's died. The third misconception, and I was teasing you about your age, is that people in middle age often think that they're too old to be donors. I'll talk to people in their 50s or in their 60s and they'll smile and say, Frank, you know, I support this cause, but you don't want my organs, I'm much too old. And it just really isn't true. The state of your organs is not particularly a function of your age. It depends very much on your overall health condition, on how you've lived your life, on what diseases have afflicted you. We routinely recover organs from people in middle age, and we have recovered organs from people in their 80s and 90s. We had a lung donor 2 years ago, a woman who was, I think, 89, and she had a pair of lungs that worked wonderfully in the recipient. She lived a long life, and now somebody else is enjoying the benefit of her lungs. So age is not a barrier. What we tell people is that the physician, the transplant physician, will make the decision on the suitability of the organ. And if they support the cause, we ask them to register so that we can have the opportunity to consider that possibility and let a medical professional decide the suitability of their organs.